Today we can discuss something about fungal diseases affecting the lungs. It is a very vast topic. There are a good number of fungal diseases which can affect our internal organs. These fungi are present universally in nature, and we are constantly exposed to fungal spores. But very few are pathogenic to man. Otherwise, it is present normally in the environment or is present normally inside our body. Under certain circumstances, this can become pathogenic. And our regarding pulmonary affections caused by these fungal elements, like occupational lung disorders, the lung is constantly exposed to the external environment, and there are two possibilities, or there are two type of fungal affection can happen in the lungs. Firstly, due to the direct growth of fungus or the organism inside the respiratory tract, or diseases that can arise from allergic reactions due to fungal particle. In the second instance, there is no growth or multiplication of fungus inside the lung tissue. So that's the introduction about fungal disease of the lung. As you know, broadly we can divide fungal diseases into superficial mycosis and systemic or deep mycosis. We are discussing pulmonary mycosis or fungal infection of the lung. It comes under systemic mycosis, and you might have studied superficial mycosis in dermatology. Now that in that classification, there are conditions like tinea versicolor, tinea assassinata, cutaneous candidiasis, etc. And there are a good number of diseases that can affect our internal organs, and we are discussing few of the conditions here. And before that, we can classify fungal disease or fungal infections of the lung. How can we classify fungal lung diseases? We can divide fungal lung diseases into four, or can divide it into under four categories. First of all, infection caused by actinomyces. Actinomyces. These are filamentous organisms of bacterial dimensions. So this considered as fungi, or it is having features of bacteria also. They are filamentous organisms of bacterial dimensions, and two organisms coming under this actinomyces group are diseases are actinomycosis and nocardiosis. Actinomycosis and nocardiosis. So that is the first group. Then the second group is infections caused by yeast or yeast-like fungi. Infection caused by yeast or yeast-like fungi. And there are two important diseases coming under this group. They are candidiasis. You might have heard of candidiasis. There's another name for candidiasis, that is moniliasis. Then the second one is cryptococcosis. Cryptococcosis or torullosis. So these two are caused by yeast-like organisms. So that is the second group. Then third group is infections due to filamentous fungi. In the first classification, where it is filamentous type of filamentous organism having a bacterial makeup or bacterial dimension. Here it is purely filamentous fungi. Then come conditions like aspergillosis and mucormycosis. These two conditions are coming under filamentous fungi. Then the last group is infections due to dimorphic fungi. Dimorphic fungi. And there are four important diseases coming under uh, dimorphic fungi. Different disease caused by dimorphic fungi include coccidioidomycosis, then histoplasmosis, blastomycosis, and sporotrichosis. So these are the four important diseases coming under infections caused by dimorphic fungi: coccidioidomycosis, histoplasmosis, blastomycosis, and sporotrichosis. So these are the four subgroups coming under the classification of fungal lung disease. Infection caused by actinomyces, infection caused by yeast-like organisms, infection caused by filamentous fungi, and the last group is infection caused by dimorphic fungi. Then regarding the source of infection, as I have said, the fungal particles or fungal spores are present throughout the environment. There is easy chance of entry into human body, and many of the fungal elements are present inside our body also, in the oral cavity, in the gingiva, the gastrointestinal tract, etc. So the source of infection can be exogenous or endogenous. The exogenous source is usually soil or dust or decaying vegetations, while endogenous infections uh, are from the source can be from the oral cavity or from the GIT. It happens in candidiasis or actinomycosis. These actinomyces are mainly present in the oral cavity. Then there are certain predisposing factors. What are the factors which can lead to systemic fungal infections? That's very important. It's not usual. The systemic fungal infections are not as usual as like other chronic diseases like COPD or obstructive lung disease. It's not so common. And there are certain predisposing factors for this fungal disease. Let's see what are they. First of all, certain therapeutic regimens, long use of certain medications can lead to systemic fungal infection. In that comes intake of cytotoxic drugs, then intake of steroids, then prolonged use of antibiotics, then taking immunosuppressants, for example, in organ transplant, etc., immunosuppressants, radiotherapy, in all these situations. So, certain therapeutic regimens can predispose to systemic fungal disease. So, that's the first instance. Then, secondly, malignant disorders itself. Malignant disorders, for example, carcinoma of bronchus, lymphoma, leukemia, all this can predispose fungal infection, systemic fungal infection. Then certain metabolic disorders also. The notorious and the most common one is diabetes mellitus. Diabetes mellitus can directly result or can result in fungal infection in several areas. Then hypothyroidism, hyperthyroidism, obesity, Addison's disease, all this can lead to fungal disease. Then another possibility is pulmonary diseases, other pulmonary diseases or predisposing pulmonary diseases like pulmonary tuberculosis, then bronchial asthma, bronchiectasis, cystic fibrosis, and any cavitary disease. All this can lead to fungal, systemic fungal infection or lung disease. So, pulmonary tuberculosis, CALM, or any cavitary disease involving the lung, all this can lead to fungal disease of the lung. Then certain hematologic conditions are there, like a granulocytosis, aplastic anemia, then myelofibrosis, etc. All this can lead to fungal diseases. Then immune deficiency state like HIV or AIDS, HIV infection or AIDS. Then congenital hypogammaglobulinemia, etc. Immune deficiency state can lead to fungal infection. Any condition that can leading to immune deficiency can predispose fungal systemic fungal infection. Then miscellaneous factors are also there, like deficiency syndrome, deficiencies, then extremes of age, old age, very young people, then pregnancy, etc. All this can lead to fungal infection. So these are the common predisposing factors which can lead to uh, systemic fungal disease. So that's about the introduction, the classification, general consideration of or consideration of fungal affection, then classification of fungal disease or systemic fungal classification of systemic fungal disease, and the predisposing factors of fungal infection. Then we can move on to individual conditions. First of all, actinomycosis. Actinomycosis or ray fungus disease, so otherwise called a ray fungus disease. So we can discuss